Alright, now we're going to pick up, continuing where we left off. We're discussing sleeping. We're going to move into dreams now for part 4 of chapter 4. Dreams are products of an altered state of consciousness in which images and fantasies are confused with reality. Usually, only when people wake up do they realize they have been dreaming. Although some people report that they do not remember their dreams, everyone dreams unless a particular kind of brain injury or particular kind of medication interferes. REM dreams versus non-REM dreams. In short, REM dreams are weird and non-REM dreams are dull. REM dreams are more likely to be bizarre and include intense emotions, visual and auditory hallucinations, and uncritical acceptance of illogical events. Non-REM dreams, on the other side, are relatively dull. For example, you might dream about what sweater you should wear. As an explanation, non-REM dreams have a general deactivation of many brain regions, whereas for REM dreams, many brain structures associated with motivation, emotion, reward, and vision are active, whereas the prefrontal cortex is not. If the prefrontal cortex were active, you wouldn't be able to accept the illogical things that happen in dreams. Brain regions in REM dreams. These two views of the brain show the regions that are activated, shown in red, and deactivated, shown in blue, during REM sleep. As seen here from the side, the motor cortex, the brainstem, and visual association areas are activated, as are brain regions involved in motivation, emotion, and reward, for example, the amygdala. The prefrontal cortex is deactivated. As shown here from below the brain, other visual association areas are activated as well. This view also reveals the full size of the prefrontal cortex. What do dreams mean? Well, Freud believed that dreams contain hidden content that represents unconscious conflicts. Freud published one of the first theories in his book, The Interpretation of Dreams, in the year 1900. There's the manifest content. This would be the plot of the dream. It's the way the dream is remembered. And there's latent content. This is what the dream symbolizes. The material disguised in the dream to protect the dreamer from confronting a conflict directly. No scientific evidence that dreams represent hidden conflicts or for the special symbolic meaning of dream images exists. The activation synthesis theory. This is a theory of dreaming. This theory proposes that the brain tries to make sense of random brain activity that occurs during sleep by synthesizing the activity with stored memories. Emotion centers, or the limbic system, in the brain are active, which explains the intense emotions. Frontal cortices are not active, which explains the uncritical acceptance of illogical events. What is altered consciousness? Well, it can be potentially altered by hypnosis, meditation, and immersion in an action. There's an example called flow. You'll find it referenced when talking about video games. Driving, it happens while driving. So the sense of time going by faster, like sense of loss of time. All right, the first one was hypnosis. This is a social interaction between a person and the person giving the hypnosis. The person is responding to suggestions, experiences changes in memory, perception, and/or voluntary action. Induction, the hypnotist making a series of suggestions such as you are becoming sleepy or your eyelids are drooping. That is post-hypnotic suggestion. Hypnosis works primarily for people who are highly suggestible. There are a couple of theories on hypnosis. The first is the socio-cognitive theory. Hypnotized subjects are role-playing. For example, they are acting how they believe hypnotized subjects are supposed to act. And the other is the neo-dissociation theory. Hypnosis is a trance-like state where conscious awareness is separated from other aspects of consciousness. Numerous brain imaging studies have supported the neo-dissociation theory. Sounds a little bit more plausible anyways. Hypnosis can be used for pain. This is called hypnotic analgesia. Clinical evidence shows hypnosis can be used to treat immediate pain, for example, surgery or burns, and chronic pain, for example, arthritis and cancer. Self-hypnosis is also shown to be effective in improving recovery after surgery. Clinical evidence is hypnosis doesn't reduce the sensation of pain, but rather alters our interpretation of it, or your perception of it. Meditation produces relaxation. Meditation is a mental procedure that focuses attention on an external object or on a sense of awareness. Concentrative meditation is focusing attention on one thing, such as your breathing pattern, a mental image, or a specific phrase, sometimes called a mantra. And there's also mindfulness meditation, letting your thoughts flow freely, paying attention to them, but trying not to react to them. The brain on meditation. In these fMRI scans, the circles indicate brain areas that typically show less activity when people are sad. After control subjects watched sad clips from movies, these areas of the brains were less active, as expected. However, the brains of participants who had received 8 weeks of meditation training, these areas remained active, indicating these participants felt less sadness. And that concludes part 4, chapter 4.